In this video, you'll learn the difference between dementia and Alzheimer's disease. At the end of the video, I'll give you one actionable step you can take if you're faced with the idea of having a progressive illness. A couple came into my office and they were lovely. I'll call them Jim and Lucille for confidentiality purposes. Jim was this short, spry man in his 70s, and Lucille was a few years older, but she was quite the conversationalist. She readily told me the story of when they first met over 50 years ago, and Jim was not intimidated in the least by the fact that she had 2 inches on him and she was the belle of the ball. He quickly asked her out that night, and the rest is history. Now, when they came in, Jim was pretty stressed. And this isn't unusual for people who come to see me, but the way that he conceptualized his problem was pretty unique. Jim emphasized that he loved his wife dearly and that he really needed to know whether she was experiencing dementia or if her diagnosis was Alzheimer's disease. In his mind, if she were diagnosed with dementia, it meant that they really had no options. There was nothing that could be done, and that ultimately she was destined to experience a miserable end to her life and a miserable death. Whereas if she were diagnosed with Alzheimer's disease, he thought there were more options available to them in the form of resources from the Alzheimer's Association, clinical trials that were designed to investigate and treat people with Alzheimer's disease, and even medications that have been approved to treat people with Alzheimer's diagnoses. Since this was their very important million-dollar question, they had been to several providers, and they were always asking the same thing: what's her diagnosis? You would think it would be a pretty straightforward process. You go in, you see your provider, you get an answer, and you move on. It really wasn't like that for them. They kept getting different answers. In one instance, they were told she just had a mild problem. At another provider's office, they saw the word dementia coming up in her chart, and one provider flat out said, hey, this is Alzheimer's disease. So with those different words floating around, the couple felt very confused. They didn't understand what she was diagnosed with or what she was experiencing, and they didn't have a clear path forward. Diagnostic confusion is a problem, not just for the patient, but also for loved ones and family, for providers, and for anybody else who wants to help. This brings up the big question: what is the difference between dementia and Alzheimer's disease? And does that distinction make a difference in terms of treatment or other ways to address the problem? Today we'll go through the terminology so that you can use the words to describe your experience and to communicate that experience to others. Dementia is a pretty scary word for people. It comes from Latin, the word demens, and it roughly translates to out of mind or without mind, and has been linked to the idea of being insane or mad. As you can probably imagine, that's a terrible thing to be associated with. And in 2013, the American Psychiatric Association was updating their diagnostic manual and said, we really need to change this to something that's less stigmatizing. They chose the term major neurocognitive disorder. You may see that term now in medical records and so on, but you might also run into this idea of dementia because it's a very familiar word for people. Whatever term you're using, it's important to understand that dementia or major neurocognitive disorder isn't actually a disease itself. It's an umbrella term that means you're experiencing a certain set of symptoms. These symptoms must include things that Lucilla was experiencing. First, she showed declines in one or more areas of cognitive functioning. Her primary problem was in memory, but she was also experiencing difficulty producing everyday kinds of words when she was talking in regular life. If you're interested in further detailed information about the different domains of neurocognitive functioning and how to understand them and differentiate between them, feel free to click here or look below in the section below, and I'll have a link to that video. Second, Lucella's problems were interfering with her ability to be independent in everyday activities. For example, she couldn't manage her medications on her own anymore. She was making too many mistakes, and Jim had taken that over for her within the last year or so. Third, Lucella wasn't experiencing a delirium, which is usually an acute, sudden change in behavior and functioning that's linked to things like having a fever, certain types of infections, side effects from some medications, or other similar types of problems. That can be characterized by restlessness, delusions, and really incoherent thought or behavior. Finally, Lucella's symptoms weren't better explained by a different type of psychiatric problem. For example, she wasn't suffering from a severe depression or some other psychiatric disorder like schizophrenia. So Lucella's experience did qualify for a diagnosis of dementia or major neurocognitive disorder. But then it's important to realize that even with that word attached to it, that doesn't tell you the cause or the etiology of the problem. On one side of the umbrella are potentially reversible problems, things like severe depression, different types of infections in your urinary tract or bladder, certain side effects from medications, thyroid imbalance, deficiencies in certain vitamins, or even normal pressure hydrocephalus, where there's spaces in your brain that are supposed to have fluid in them, cerebrospinal fluid, but for some reason that fluid builds up and there's too much of it. Jim's older sister, in fact, had been experiencing cognitive problems that were pretty concerning to her and to her family. But upon further investigation, she was actually found to be experiencing a severe episode of depression, and she was diagnosed with the pseudodementia of depression. Or in other words, she looked so bad in terms of her cognitive functioning that she could have been diagnosed with dementia, but actually it was related to her emotional dysfunction and her depressive symptoms. Once the depression was treated, her brain worked better. Causes that we don't currently know how to fix include degenerative types of things, such as Alzheimer's disease, vascular dementia, dementia due to Lewy bodies, frontotemporal dementia, dementia related to Parkinson's disease, and so on. So the providers speaking to Jim and Lucelle were potentially all consistent with each other, but using different terminology in a way that was really confusing for the couple. She was ultimately diagnosed with dementia or major neurocognitive disorder, and the cause of those symptoms was related to Alzheimer's disease. Was Jim right in thinking that a diagnosis of dementia means that nothing can be done? No. Depending on the cause, it might be reversible and we can do something to fix the problem entirely. If we don't know how to reverse the specific problem yet, such as the case with Alzheimer's disease, there are several things that can be done. We can help people identify cognitive strengths and use them in their daily lives to compensate and work around the weak parts. We can help people connect with supportive resources so they're not alone. We can help people collaborate with and participate in clinical trials that might provide the steps to a cure or significant treatment benefits. And we can help people stick to a path that really emphasizes quality of life. One actionable step that you can take is to sign up for Trial Match. This is a United States-based national program that's orchestrated by the Alzheimer's Association. It connects regular people like you and me with ongoing clinical trials that can be useful in the treatment of problems associated with dementing disorders or actually curing them. At the timing of this video, I looked to see how many research trials were available for participation, and there were over 1,000 different research trials available across the spectrum of problems such as a mild neurocognitive disorder, Alzheimer's disease or dementias in general, such as dementia with Lewy body, frontotemporal dementia, Parkinson's related dysfunction, and so on. We've just learned some important terminology in terms of how to understand brain functioning and how to communicate effectively about it. Feel free to watch my next video on what to do if you're worried about having Alzheimer's disease or some other dementing disorder. Or skip ahead to one of my next videos that talks about what you can do to optimize your brain functioning.
You only get one beautiful brain, and I'm here to help you bring the science of brain health home.